Hi everyone, thanks for listening to my presentations. Today I'll be talking about amiodarone. This is a type of medication and you can sit back and let's get all the facts. Depending on your jurisdiction and the trade name given by the manufacturing company, amiodarone could be Nestirone, Pasirone, Cordurone, Apple amiodarone, River amiodarone, Sandoz amiodarone, or Teva amiodarone. It is a class 3 anti-arrhythmic agent. Uses of amiodarone. Amiodarone is very useful in atrial fibrillation, atrial flutter, prevention of post-operative atrial fibrillation or flutter, in structural heart disease with arrhythmias, in atrioventricular nodal reentrant tachycardia, also in atrioventricular reentrant tachycardia, in focal atrial tachycardia, in ventricular tachycardia or ventricular fibrillation. Now, note this. In anyone with implantable cardioverter defibrillator and having now rhythmic shocks, if you want to prevent that, you use amiodarone. So amiodarone is useful in prevention of implantable cardioverter defibrillator shock. Also in prevention of sudden cardiac death due to ventricular arrhythmia. For example, ventricular fibrillation. Also useful in advanced cardiac life support. Amiodarone could appear in different forms as amiodarone intravenously, that is amiodarone IV, amiodarone per oral, or amiodarone in form of solution that could be a premixed solution of IV infusion of 450 milligram in 250 ml of D5. The solution could also be IV as hydrochloride, generic 150 milligram per 3 ml, or Nestirone at 150 milligram per 100 ml in 100 ml dextrose. Could also come in form of tablets as hydrochloride, and here we'll have Pasirone as 100 milligram, 200 milligram, or 400 milligram tablets, or generic as 100 milligram, 200 milligram, or 400 milligram tablet. Could also come in other forms like generic IV as 50 milligram per ml, or per 3 ml, per 6 ml, 9 ml, or 18 ml. And also in the form of tablets as Cordurone 200 milligram DSC and generic as 100 milligram or 200 milligram in some jurisdictions. Okay, in an adult, if amiodarone will be administered intravenously or as an infusion, if the infusion is for a period greater than 1 hour, then we need to follow the following. If we're using peripheral line, we have to use less than or equal to 2 milligram per ml only. And if we're using peripheral line, an inline fetal will prevent phlebitis. Let me repeat. If the line you are using for your amiodarone intravenous infusion is peripheral line, you cannot give more than 2 milligram per ml, okay? But if you want to go higher, if you want to go more than 2 milligram per ml, then you use central line. And you use only volumetric infusion pump. In advanced cardiac life support with pulseless ventricular tachycardia or ventricular fibrillation, don't dilute, but consult with your team, please. Okay, still on infusion. Slowed infusion if you are faced with hypotension or bradycardia, but it depends on the degree of the hypotension or the bradycardia, because you might have to stop the infusion completely, but consult with your colleagues around. If the infusion will be greater than 2 hours, please don't use PVC, but glass or polyolefin. Incompatible with heparin, and avoid extravasation. But if inadvertently extravasation should occur, then stop the infusion. No flushing. Aspirate. Elevate the arm or forearm and apply an antidote, hyaluronides. If you are administering amiodarone per oral, give with meals in divided doses placed, particularly if a daily dosing is causing gastrointestinal upset. And no grapefruit with oral intake. Do you know why? Okay. Grapefruit will inhibit hepatic enzymes and thereby keeping the level of amiodarone very high in the serum, and then tilting the dosage or the concentration to the toxicity level. And if care is not taken, the individual taking the medication will be in big trouble facing amiodarone toxicity when you allow the patient to take grapefruit while taking amiodarone. And not only grapefruit, but that is the simplest one that we can counsel the patient against. Drug-drug interaction, by the time we reach there, will reveal that certain medications that could inhibit hepatic cytochrome, hepatic enzymes, will actually lead to higher concentration of amiodarone in the serum and the possibility of toxicity. So no grapefruit while taking amiodarone per oral. In pediatrics, all medications in pediatric is by milligram per kilogram, whatever route you choose. So the loading dose here is 5 milligram per kilogram intravenously, given slowly over 60 minutes. We can repeat for maximum of 15 milligram per kilogram during acute phase. But if you are giving it per oral in pediatrics, the loading dose will be 10 to 15 milligram per kilogram per day in 1 to 2 divided doses for about 14 days or less until the arrhythmia is controlled or the control of the arrhythmia is achieved. If you want to have infusion done in pediatric age group, very, very small dose, like 5 microgram per kilogram per minute. In geriatric patients, start slowly and titrate up, depending on what the EKG is showing you. Adverse reactions. Hypotension. I've mentioned this in the course of this presentation before now. Pulmonary phospholipidosis, nausea, vomiting, bradycardia. I've also mentioned that before now. Atrioventricular block, worsening of arrhythmias, flushing, and prolonged QT. Okay, when we get to prolonged QT, I need to talk more because with prolonged QT, if there's no correction on time, that will lead to thyroid. Without immediate intervention, thyroid will go down to ventricular tachycardia, and ventricular tachycardia will go down to ventricular fibrillation. Without any defibrillation, we will be getting to asystole. And from asystole, without advanced cardiac life support, the affected person will be dead. Still on adverse reactions, abnormal gait, that is ataxia, insomnia, Stevens-Johnson syndrome or toxic epidermal necrolysis, hypothyroidism, hepatotoxicity, pulmonary fibrosis, and pneumonitis. You could see that I colored hypothyroidism and hepatotoxicity with pulmonary fibrosis. Hepatotoxicity and hypothyroidism could be fatal, and we will talk more about them in a bit. Still part of adverse reactions, aplastic anemia, agranulocytosis, hemolytic anemia, hemoptysis, thrombophlebitis. Someone is even asking, then why taking this medication then if we're going to be faced with all this? Hello, it's not going to happen to everybody. And of course, your doctor will always keep an eye on you when you're on this medication. Contraindications. That is, situations when amiodarone will not be prescribed or cannot be taken by any patient. Hypersensitivity to amiodarone itself or hypersensitivity to iodine. With that, no amiodarone. In the phase of heart block, no amiodarone. When the vital signs is showing that the heart rate is low, please be careful. Don't give amiodarone. In cardiogenic shock, no amiodarone. When there is evidence of hepatitis, because amiodarone on its own could give fatal hepatotoxicity. Now someone is already having hepatitis before taking the medication, no more, no amiodarone. The phase of thyroid dysfunction, because amiodarone on its own could lead to fatal thyroid disorders, no amiodarone. When there is pulmonary interstitial abnormalities, because amiodarone on its own could give pulmonary fibrosis with pneumonitis, then no amiodarone. Warnings. I don't like giving warning because I'm not a military officer, but for the sake of the safety of everyone that will be taking this medication, we need to take some precautions. Remember, bradycardia, hypotension, Stevens-Johnson syndrome, or toxic epidermal necrolysis. I've mentioned each of these in the course of this presentation before now, and each could kill. Fatal hepatotoxicity. Hepatotoxicity secondary to the use of amiodarone could kill. Therefore, we must get the liver function test done, including the level of the enzymes, before administering the medication at all. And while the patient will be on the medication for an appreciable period of time, we should continue to repeatedly measure the liver function test and the enzymes. And whenever we are finding the value to be 3 times greater than the normal level, we should discontinue amiodarone. Still part of the warning is we should be careful because we're going to be dealing with peripheral neuropathy. if this medication is used on long-term basis. Hello, there's possibility of visual loss or permanent blindness. Therefore, let our friend in ophthalmology department be having a look regularly. Avoid sunlight exposure. I'm going to listen. I pray that woman or man will not go to the beach, say, oh, the weather is nice in summer. I have to enjoy myself. Remember, you are on Amiodarone. You will turn blue-gray. Still on one, we have to get the EKG ready because Amiodarone can exacerbate the arrhythmia, prolonging the QT, tilting into torsadic point, and from there to ventricular tachycardia, and from there to ventricular fibrillation and asystole, then the patient is dead. Also, Amiodarone can cause hypothyroidism or hypothyroidism, and it may be fatal. We have to correct the potassium level, okay? Because, in fact, on my channel, check my channel for hyperkalemia. I have a separate presentation on that. Because hyperkalemia on its own can kill. When the value is very, very high, we look for calcium gluconate, our glucose, insulin, salbutamol. But when it's not horribly high, maybe we cancel against diet and stop the medication like potassium sparing medications. And then we give Kaiserate, okay? Correct magnesium, because low magnesium level will give us prolonged QT, and of course calcium level. Then we could be dealing with thrombosis, pruritus, and neutropenia. And with neutropenia and granulocytosis, susceptibility to infection will increase. Lastly, still part of the warning, don't use this good medication in Wolff-Parkinson-White syndrome. And somebody is asking me why that? Because it can lead to ventricular fibrillation and death. Someone is saying, why death when it comes to Amiodarone? And a lot of people are taking it, but your doctors are monitoring you. Good thing is not over the counter. Drug-drug interaction, I will leave that to the pharmacist. I called and asked them. All enzyme inhibitors will be increasing the serum level and toxicity. So, no grapefruit and the rest enzyme inhibitors. And with that, I've come to the end of this presentation. Remember to share and subscribe and leave comment or comments. I appreciate. My heart to everyone suffering and using this medication. Wishing all of them a quick relief and speedy recovery. I appreciate it. Thanks.